Hello and welcome to my blog, part 2 of learning about uterus cancer. And so what I'm going to be talking to you about for this particular session is I'm going to tell you about the chemotherapy that they're using on me, how did it went, how does it go, and how long did it took about, also how I was feeling before and how I was feeling afterwards, and a few days later on. So this will be the first one because I just got one chemotherapy so far, and my next one will be next Wednesday, this Wednesday. So I'm getting chemotherapy every week for about 6 weeks roughly. This is only an estimate. It's basically until my blood level's back to 0, and then I should get about 2 other shots to make sure the cancer is fully killed. However, I'm still gonna have to do the blood test monthly after that, I guess. Right now it's weekly, but once the blood level's at 0, once they give me the okay, it should be monthly for a year. So the injection that they're using on me, it's I'm sorry, I'm French, so I'm not sure if I'm gonna say it well. Methotrexate injection. I don't think that's the right word, but here it is. I'm gonna show you, and I'll spell it to you too, just in case if you want to do research on your own. Okay, so it's spelling Methotrexate injection. Okay, so they use this particular one to treat many type of cancer, many different type of cancer. What they're saying about this one is you have to tell your doctor before using this, obviously, if you have any medical condition, especially liver disease, kidney problem, or if you have any allergies. They're also saying that this may be harmful for any unborn babies. So if you're pregnant, or if you breastfeed, or if you are planning to become pregnant, to let them know. And also they're saying another section here that I did not see when the doctor gave me that. Unfortunately, I would have asked more about it if I knew before. But I'm not going to stay stuck in it, and I'm not going to be too concerned about it for this time. But it's saying people who have cancer are at high risk of developing other cancer of blood clot. Also, some cancer medications, such as this one, may increase these risks. You should discuss this with your doctor. So I would suggest that you do before using it. It's always good to know more about it, or just to get your mind at ease. Your doctor may say something very positive about it. It's gonna put your mind at ease. So I surely wish I did. They're also saying to use 2 birth control form to make sure to don't get pregnant, because if you get pregnant during these kind of treatments, or during this 1-year period that it's important to be followed up, it might actually, it's going to show that you're pregnant instead of showing that you have cancer, and you might have the cancer during that time. So it's very important to don't get pregnant during that time. The way it's giving, it's through a muscle, so it could be either vein or muscle. So if it's by the vein, it's that sac that it's coming down through your vein, and it takes about 15 minutes for what I'm reading here. Although the way they did it this time for the first shot that I got was through my muscle. Basically, it was like a flu shot. Except the needle was about this long, and it goes through your muscle, fully through your muscle, all of it. And also it goes quite quickly. I mean, she just injected, and it's 2 of them full of that yellowish liquid. Obviously the needle hurts a bit, right? I was standing up, and a chair in front of me, I was holding the chair. I was getting dizzy during that time, so I had to breathe very deep, in and out slowly, to calm myself and to get myself under control because I was going to faint. And actually when the liquid was injected, it was kind of burning. I would say the pain and the burning feeling lasted for, the pain maybe, the burning was maybe 5 minutes, not even. The pain, obviously it's on the muscle, a little longer, 5 to 10 minutes. But it wasn't that bad, so I was more scared than anything. Now I know what to expect, so I think I should be better at it this time around. So that's basically how I got it. It was on my muscle, on my hips, and they did one side this week. They're gonna do the next side next week. And while you're having this, it's very important that you talk to the doctor about what kind of medicines you're taking, or vitamins, or herbal tea, or whatever, because it could interfere with this and it might not be good. So a lot of type of vitamins don't match up with this. And also medicine. For what I'm seeing here, you could take Tylenol, but they don't suggest to take Tylenol because during the treatments, the day of or weeks later, you could have fever, and that would mask it. And it's important for you to know if you do fever. So, but I'll go through that shortly. The side effects that you may have during this time. This is the most common side effects, so it's 10 people, over 10 people out of 100 who had those side effects. So unusual bleeding or bruising, fever, chill, infection. So if you have those, you have to get to the emergency right away. Now the fever, chill, the fever is for above 38 degrees. For what I'm seeing here on the papers. However, what they gave me at the hospital, well, both of them is from the hospital, but I have another paper here that's saying above 38.4. 30, okay, if so, this one's saying if you're 30, between 30 to 38.4, which means 100.4 to 101.2 Fahrenheit, to recheck in 2 hours. But if you're above 38.5, to talk to the nurse or go to the emergency. So they're saying to check your temperature frequently to make sure, to wash your hands often, to use soft to brush, and that's basically it. Also, you could have mouth sore. For this, they're saying to use a very soft toothbrush and brush your gum as well as your teeth very softly. Instead of using mouthwash, they're saying to use half a teaspoon of baking soda in a cup of water, to avoid hot and spicy, acidic, hard and crunchy food. And that's about it for the mouth sore. Also for the nausea and vomiting, I had that myself, and they usually prescribe medicine for the nausea, which helps. It helps, yes and no, actually. It got it under control. I didn't have to vomit, but I still had some nausea one of these days this week. So, but this may occur. And tiredness, obviously. So they say for the tiredness to rest often, take nap if needed, move slowly when getting up, eat well-balanced meal and drink plenty of water. Light exercise may help. And they say to don't drive, obviously, when you feel very tired. The less common side effects, which is for less than 10 people over 100, or the following. Now, those are a little bit more scarier, but hopefully it won't happen to you and it won't happen to me. But it surely didn't happen yet. So, an allergic reaction, a blood clot. Now, this blood clot is not the blood clot that I have been having with my bleeding, but this is more, it seems to be occurring with the lungs. So if you're coughing, you're having breathing problem, chest pain, and you're coughing blood. Effect on the brain, so severe headaches, which I've been having, Loss of consciousness, no. Seizure, confusion, hallucination. So I didn't have the others, thank God. But I had the severe headaches, which it was basically migraine that I had. Hair thinning or loss, kidney problem, liver problem, lungs problem, pancreas problem, redness, rash in areas where you previously received radiations. Also, there's rash, dry, itchy skin, rupture in stomach or intestine wall, serious skin rash, stroke, heart attack, rapid killing of cancer cells when you start treatment may lead to buildup of cell waste products. So hopefully I'm not scaring you with this, because when you think about it, every medicines that you're getting over the counter, there's always a long list of stuff that could happen. So better get that and get this cancer out of control, get it on control and get it rid of it, than out of control and spreading somewhere else. So I obviously accepted this, very well knowing of the side effect, but I'm hopeful that everything will go for the best. So the day of the treatment, how I felt the morning, obviously I was anxious and scared. This was my first time. I went to the hospital, and when I saw, it's a hospital specialized for cancer, and when I was there and saw all those cancer patients, it hit me that I had cancer. It didn't hit me before that, and it actually hit me on that day when I saw all those cancer patients. You're seeing some that look very sick, other looks better, some without hair, some very weak. You're seeing all types depending on the cancer, depending how far they are. So it kind of is a little scary, obviously, and at the same time it's a reality check that it's happening to you. So I was fortunate enough to have somebody to come with me to support me, and I'm very grateful for that person. So the what I had before that, I had my blood clot, like I said to my previous blog, and I had some back pain, a little bit of tummy pain. Again, the back pain and tummy pain just go off and on. It comes, it leaves, it comes, it leaves all the time. I had a little bit of a headache from the stress, I'm guessing, but I believe that's about it. So the way it works for the chemo at my hospital, the way it works is that first you have to do blood tests. Then they send your blood test to the lab to get the result, which takes at least an hour, but shouldn't take more than an hour and a half. After the result, they send that to the doctor. The doctor analyzes it, does a requisition for the chemotherapy, and it sends that, and they create the chemotherapy, and then they come and give it to me. So just to let you know, my appointment was at 10 o'clock in the morning. I had to be there 15 minutes earlier for the registration, and so I was there at 9:45, and I left the hospital at 2 o'clock in the afternoon. They always give you your next appointment on that day as well. So it took a long time. You have to be patient. It's for a good cause. There's nothing better to do but to wait and to be hopeful that it's going to help you at the long run. So this waiting time, it's worth it. So I'm not frustrated about it. I appreciate it, because this is what's going to save my life, basically. So I received the injection, which was 2 injections, just like I mentioned. It was very similar to flu shot, but in my muscle, in my hip. I already said how I felt about that, how it felt, the pain and all that, which was not major. It was fine. Once again, for a good cause. And how I felt afterwards is I started bleeding. I'm not 100% sure about the bleeding. I had blood clot that I'm 100% sure. But I'm not sure if that bleeding started before, on the morning, before I went to the hospital, or afterwards. But I started to have bleeding with my blood clot. So like period. However, my bleeding is very strange since then. One moment it could be a light red, just like if you bleed from your nose, very thin. Other time could be like a period, which is a dark, heavier bleeding, and other time it's extremely dark, almost brown, very light. So it's kind of weird. Throughout the day it could change in this kind of period. So it's kind of weird, but I guess it's normal. I called the nurse and she said it's the cancer that does that. It's not the chemo, but it's the cancer that does that to me. And she said to call her if it changed or anything like that, to give it the weekend. I spoke to her on the Friday. She said give it the weekend, and if it changed, it becomes heavier or more weird, to give her a call and to let her know. Also, the way I felt, I had a migraine starting. I would say maybe within an hour. I had a huge migraine and I couldn't take anything for it. So it was disappointing for that, but I couldn't. I was tired, very tired. I wanted to sleep after that, not too long after. Once again, maybe an hour within the injection. I would say I could have stayed up. I'm gonna rank it as a percentage. 100% would be that I had to sleep. There were no other option. That's all I could do. And 25% would be just a light tired, like when we're changing the clock of time, how tired we are for a couple of days. That would be the 25%. So the way I was tired after the chemo, I would say about 75 to 80%. So I really wanted to sleep and I couldn't stay up that much, but I was capable of it. And also I was searching for my words a lot when I was talking. That's what I realized. And I had back pain, tummy pain again. What else did I had? My God. I had nausea. It's true. At 3 o'clock in the morning, I had nausea, so I had to take a pill for it. And I was not sleeping so well either. Another thing that I realized, and I'm gonna have to talk to the doctor about that, is that my head, the skin inside in my head, was actually burning a little bit and itchy. So not to the point that I was going to scratch at this, but a little itchy, and it was burning. So I'm gonna have to ask about this one because I'm a little worried. Hopefully it's nothing major, it's just normal. So that was the day after the day of the injection. Now, how I was the day after, the immediate day after, I was feeling pretty much the same way as well. I went to work in the morning. When I got up, I felt fine, tired at 25%, but I felt fine. Within max 2 hours of working, I started to have some pain, tummy pain, back pain again, a little bit of nausea, but not too much, not too strong, and headache. Not a migraine, but a headache. Now the bleeding keeps going, obviously. It's still, in today's day, still going. And at 3 o'clock, I was tired at about 75%. I really was, like, my day was on me, and I just wanted to go home. So, but I toughed it out because I finished working at 4:30. So I toughed it out, and I was capable of it. But once I was home, I needed to rest immediately. The day after that was the Friday, and on Friday, once again, I got up in the morning, felt fine, tired at 25%, but I felt fine. And around 10 o'clock in the morning. I was at work once again. Around 10 o'clock in the morning, everything hit me. On that day, I was getting up often. I had to get up very often to walk, to go one place another, to come back to my desk, and a lot of that. And around 10 o'clock in the morning, I felt extremely nauseous, so I had to take a pill again. Again, those pills are as needed only, and it takes about an hour to work. It could get you drowsiness for the pills that I'm taking. Maybe not all of them, but that's the one. And so I had all the other, again, pain, back pain. I'm talking to you right now and I'm having back pain. So sorry about that. And around noon, a little bit around noon, I had to go home. I couldn't take it anymore. So that's what I did, and I came home to rest. At that point, I was tired at 75 to 80%. So after that, I woke up. I felt better. I was tired I would have kept sleeping, but I wanted to work from home. So I got up. I obliged myself to get up, and at that point, I was tired at probably 55 to 60%. So I would have slept more, but I had to do a little bit more work, right? So that's how I've been feeling every day since then. This weekend, yesterday, Saturday, and today, Sunday, were April the 1st. I've been feeling better, however, still the tiredness. I've been realizing that more I do during the day, more I get exhausted and getting pain quicker. So I realized that it's important to rest, to don't do too much. And the doctor told me, the nurse told me about that, but I didn't really understood what they meant. But when was it, Wednesday that I got my my injection, so within 4 days I realized I understood what they mean, which is basically if you do too much too quickly, you'll get tired and more in pain. And also that it's important to rest as much as you can. Your body needs it. They also told me something very interesting at the hospital, which I didn't know, and I asked about it, and I said, okay, would my body get used to the treatment? So would I feel better and better, you know? And they said, no, it's the other way around. Your body will not get used to it, and your body actually, after 10 days of the treatment, usually, and again, everybody's different. Everybody's, the body and the treatment or the cancer could be different, but usually at 10 days of your first treatment, your body will kind of shut down and you'll be extremely tired. Your body needs to do that to